looks like it is one step forward and maybe a small step back. For the first time in a while, our state, the good news is, not the COVID hotspot of the country. New number of cases is leveling off. Our percentage of positive cases going down. Our R0 number measuring how many people typically affect another person down below one, meaning illnesses are falling. That's good news. And then today, I'm bringing you in Dr. Goldberg, Dr. Ross Goldberg, who works at Valley-Wide Health, president of Arizona's Medical Association. Good to see you, as always, and thank you for coming in. We get the numbers today, Dr. Goldberg, and we're kind of popping back up here. Now, I said earlier, you know, improvement generally doesn't happen on a straight line. I mean, would you agree with that? I mean, this isn't a big setback for us, is it? And you have to be encouraged by the last week, what you've seen.
Well, good morning again. Good to see you. As always, this is never going to be, like you said, a straight line. In the beginning, we kind of had what I call a sine wave. Now, the numbers are a little higher today, but I will tell you we're keeping a close eye on things because remember of that 2-week time delay we see, and we had the July 4th weekend, so we don't know what those results of those people going out, interacting. So we're going to see that in the next week. So the hope is the numbers don't go up again, and we just keep a close eye on things. But remember, there's case numbers and there's hospitalizations. We got to keep a close eye on both of those.
And hospitalizations is what you've been our go-to guy for that. And I'm glad you came back, and we're kind of checking with you week to week here. So yeah. What I've heard is this, that, and you can confirm it or, you know, tell me I'm wrong here, that, you know, you have a number of cases, but generally it takes a while for those cases to get sick enough to be in the hospital. And then when you talk about deaths as well, it takes maybe another couple of weeks until we start seeing deaths. So even though our case numbers look better, we may not have great hospital and death numbers for a while.
You're exactly right. Everything is time delayed. It goes, you know, someone gets exposed till then we find out they're positive, to find out when they're getting really sick. And then either they do better or unfortunately in some cases they don't. They get sicker and they pass away. But all that happens over an extended period of time. It doesn't happen day to day. So you look at the numbers and you kind of hope that you don't have a bad wave of people who are sick behind it. We just don't know yet.
So over the past week, we have seen the hospitalization numbers, it seems like, increase, even though we've had some days where they've popped down. And I know you talk to all different doctors in all different hospitals. How are our hospitals holding up right now, especially here in the Valley?
It's tight. Like, I'll tell you, it's interesting week to week. So we talked last Friday, things were okay. It got tight, you know, beginning of this week. And things seem to be okay right now, but resources are, you know, being pushed. We appreciate the fact that we're going to get that staffing in. That contract was signed. They're going to bring the federal staffing in, which will help a lot of the hospitals, and we appreciate that.
What does it mean when you get tight? What happens?
It's just a matter of we don't have a ceiling where we are not providing care, but it's just like anything. You have finite resources, and you're pushing the limits of what you have available. Just so we always like to have kind of redundancy and kind of cushions, if you will. And sometimes you get up close to what those are regarding staffing, resources, availability. And it just, you know, makes you more aware of what's going on and just to be more prudent with the care you're giving.
Now, you talked about that federal help coming in. We reported on that earlier this week that we had it was close to 600, I believe, medical personnel, mostly nurses coming in. How exactly are you planning on using those nurses in the hospital that you work for?
Well, again, our leadership's done a great job of kind of reaching out and asking what we need. You need nurses with a certain skill set regarding working in these COVID units, working with critical patients. So my understanding, and again, I'm not the one making the decisions, but they'll be kind of deployed to those areas where we need some relief for our current staff members. As we've talked about before, we've all been running kind of at 130% since like March. So at some point, you're going to wear down. So this will provide some good relief for those really hardworking nursing staff and other staff members that are helping provide the care.
So it's a Friday, and I'm in a pretty good mood, and I like the fact that we've gotten these positive numbers. Are you optimistic after seeing the numbers that we've been seeing over the past week or so?
I am steadfast. I am sitting and watching. It's just because we have to see how this thing develops over the next week or so. Again, I still have concerns regarding what happened July 4th. People went out. I understand they wanted to go out. We don't know what impact, if it has any. It may not, which would be great. But Ask me next week, and I'll have a better answer for you, I think.
All right, Dr. Goldberg, that's an appointment for me. Hopefully you can make it back here next Friday and we can get the week's rundown. It's always great talking with you. And again, thank you for the work that you and your entire team, I'm talking everybody who works in that hospital and around it, what you're doing right now. Really appreciate it.
Thank you so much. Have a great day.
All right, take care. Ron now breaking down these numbers. As we said, Ron, it's